Hello class, my name is Emily Francis. I am student B for bulimia. Um, I was in charge of finding an article to summarize on our topic. I chose an article called Intensive Inpatient Treatment for Bulimia, Statistical and Clinical Significance of Symptom Changes. According to the article, the American Psychiatric Association defines bulimia as a severe eating disorder characterized by an inordinate preoccupation with weight and recurrent episodes of binge eating, followed by behaviors such as self-induced vomiting, abuse of laxatives, and excessive exercise. The objective of this article is the study, which examines the statistical and clinical significance of symptom changes during the intensive inpatient treatment program, with strong focus on individuals with severe bulimia. The method of this article is to use 295 admitted bulimic patients who are administered to structured interview for anorexia and bulimic syndrome. It also focuses on the eating disorder inventory, a brief symptom inventory, and the Beck depression inventory. Even though the study talks about all these disorders, just to name a few, I am going to talk about the main focus of the study, which is bulimia. To qualify for this study, patients were to be admitted to an inpatient treatment at a hospital in Germany between 2019 and October 2014. The admission body mass index of at least 17.5 for each patient. Each patient is at least 18 years old. There were females and males both used in this study. The final diagnosis for inpatient candidates were given by the treating therapist, who was either an experienced clinician or a therapist in training under the supervision of an experienced clinician. The results of this study indicated statistically significant symptom reductions when the patients were on antidepressant medications. The majority of patients showed either reliable or even clinically significant symptom changes. The data also showed that in such intensive treatment programs, antidepressant medication does not seem to enhance the symptom decrease during treatment. Furthermore, findings on clinical indicate that about 30% of patients responded reliability and about 45% to clinically significant extent in terms of overall eating disorder. So basically, they're saying that the patients that were on antidepressants had better results than the patients who were on no medication. Finally, the findings demonstrated that patients who improved to clinically significant extent were less distressed at intake and less likely to suffer from borderline personality disorder. The findings indicated that intensive inpatient treatment may be effective in about 75% of severely affected bulimic patients. For the remaining non-responding patients, inpatient treatment might be improved through an even stronger focus on reduction of borderline personality traits. Up next, I will discuss 3 national web resources. The first is National Eating Disorders, second is National Institution of Mental Health, and the third is Academic for Eating Disorders. The first one I'm going to talk about is the National Eating Disorder website. According to the National Eating Disorder website, eating disorders are serious but treatable mental illness that can affect people of every age, sex, gender, and race, ethnicity, and social economic group. No one knows exactly what causes eating disorders, but a growing suggestion rates the change of biological, psychological, and social-cultural factors come together to spark an eating disorder. The misconceptions about eating disorders and who they affect have real consequences, leading to fewer diagnosis treatment options. The pathway to help for those who don't fit the stereotype. Understanding that eating disorders don't discriminate is critical to making sure everyone has access to help and support. This website is super helpful since it has hotlines that you can call 24/7 and volunteers that are trained to help you find the information and support you're looking for. The website has short screen tools that are appropriate for ages 13 and up. It can help determine if it's time to seek professional help if someone has an eating disorder. The website discusses resources on how to afford help. They state that everyone deserves support for their eating concerns, and the NEDA wants to connect with you with resources that can help in addition to professional help. These free and low-cost support options offer ways to connect with others and provide tools to promote recovery. A couple of their tools include Recovery Record Tool, which is an eating disorder recovery app that can be downloaded on both an iPhone and an Android. Recovery Record takes the industry's best practice for eating disorder treatment and delivers it on mobile devices. It has replaced pen and paper therapy homework with a mobile application, both the client and clinician version, so log information can be shared with professionals if desired. Another program advertised by the National Eating Disorders is Lantern, which is an online mobile program based in cognitive behavior therapy appropriate for individuals 18 years or older. Although it's not a replacement for therapy, users are matched with a professional coach who provides support in the program via messaging. The idea is to teach tools and coaching to improve body image, reduce disorder and eating behaviors, manage stress, reduce anxiety, and elevate mood. Overall, the National Eating Disorder is a great website with tons of research and information. It can be used online, the phone, or in person. The next web resource I will be talking about is the National Institute of Mental Health. Statistics show that mental illnesses are common in the United States, affecting tens of millions of people each year. Estimates suggest that only half of people with mental illness receive treatment. The information on these pages includes currently available statistics on prevalence and treatment of mental illness among the U.S. population. In addition, information is provided about possible consequences of mental illness such as suicide and disability. The website also shows research of females with bulimia and binge eating disorders sought treatment with more than males. Their vision in the world is that mental illness will be prevented and cured. Their mission is to transform the understanding and treatment of mental illnesses through basic and clinical research, paving the way for prevention, recovery, and cure. The National Institute of Mental Health is a federal agency for research on mental illness. Their mission is to transform the understanding of treatment of mental illness through basic and clinical research, paving the way for prevention, recovery, and cure. Finally, the last web resource seems to be the most important to me. Academic for Eating Disorders. The Academy for Eating Disorders is the global profession associated committee to be a leadership in eating disorder research, education, treatment, and prevention. Their vision includes global access to knowledge, research, and the best treatment practice for eating disorders. The Academy for Eating Disorders helps researchers connect and collaborate with each other and keep recent developments of eating disorder research up to date. AED's main event is the annual International Conference on Eating Disorders, a scientific conference that spans research and education from basic science to treating clinicians. The international conference is attended by leading international researchers and includes presentations and discussions on the cutting edge in the research field. The Academy for Eating Disorders began September 11, 1993. Almost 25 years ago, with a meeting organized by Craig Johnson, who has his PhD. During the 1993 meeting, in total, 33 clinicians and researchers met to discuss the concerns about the effects of managed care and other insurance practices on providing quality treatment for patients with eating disorders. This group saw the need for an organization of eating disorders professionals that embodied excellence in education, treatment, and research that could have advocated patients with eating disorders, provide professional training and development in general. The AED was formed to meet these goals, and today AED includes over 1,500 professionals from around the world who have joined together to support this mission. The current and past AED leadership has worked hard to ensure that this mission is met. The goal is to provide global access, knowledge, research, and best treatment practice for eating disorders. For the public, via website, AED provides education on eating disorder symptoms and treatment recommendations. It also generates knowledge and interrogates collective expertise about eating disorders. It provides platforms and for promotion and understanding, sharing of knowledge, and research practice on the field of eating disorders. To build capacity in the next generation of eating disorder professionals, and to foster innovation and best practice by recognizing excellence in the field of eating disorders. Funding of the academic for eating disorders only allows us unrestricted corporate funds to be accepted, and the AED will maintain complete control of the use such funds. The AED will not accept corporate support funds for political advocacy, and no more than 35% of the total annual AED revenue may come from sponsorship from a single industry. The AED will maintain a position of full disclosure of corporate support. Last but not least, AED hosts in-person events and webinars. One of the best benefits from being a member of the Academy for Eating Disorders is access in the online virtual library of education webinars, which allows us to learn current practices and research within the eating disorder community at your earliest convenience. And here's our references. Anna, seriously,